Hey everyone, I'm Dr. Alan Martinez with Dr. Mexico Dental Group in Tijuana, Mexico. One of the questions I hear from patients is, my dental implant feels loose. Has it failed? The good news is that not every loose implant has actually failed. There are several different problems that can occur, and many of them can be repaired without replacing the implant. The first step is determining exactly what's wrong. The most common reason an implant fails is infection around the implant, a condition called peri-implantitis. This usually happens when bacteria are allowed to accumulate around the implant because it isn't being cleaned properly. Over time, the bacteria attack the bone supporting the implant. As the bone is lost, the implant can eventually become loose. Another possibility is bone loss around the implant. This is often caused by chronic infection, but once enough bone has been lost, the implant may no longer have enough support. If that happens, we may need to remove the implant, rebuild the bone with a bone graft, allow it to heal, and then place a new implant later. Sometimes the implant itself is perfectly healthy, but the bite is slightly out of adjustment. If the crown is even a little too high, excessive pressure is placed on the implant every time you bite. Over time, that pressure can loosen the retaining screw, fracture the screw, or even damage the implant. That's why we spend time carefully adjusting your bite before treatment is complete. If your bite doesn't feel quite right, it's important to tell your dentist instead of assuming it will wear in by itself. Another common problem is a loose implant crown or loose abutment. In many cases, the implant itself is still firmly attached to the bone. The screw holding the crown or abutment has simply loosened. This is often a straightforward repair. We remove the filling covering the screw access, tighten or replace the screw if necessary, and reseal the access opening. Many of these repairs can be completed in about 30 minutes. Occasionally, the retaining screw itself breaks. When that happens, part of the screw remains inside the implant. Removing that broken piece requires specialized instruments and experience. Not every dentist has the equipment to do this. Here at Dr. Mexico Dental Group, I have the specialized tools and training needed to remove many broken implant screws, allowing us to save the implant whenever possible instead of replacing it. Although it is uncommon, the implant body itself can fracture. This may happen because of excessive biting forces, long-term overload, trauma, or in rare cases, a manufacturing defect. If the implant itself is fractured, it usually cannot be repaired. Removing a fractured implant is a delicate surgical procedure. We carefully remove a small amount of bone around the implant so it can be safely withdrawn without causing unnecessary damage to the surrounding bone. Once the implant has been removed, the area is thoroughly cleaned and filled with bone graft material. Many patients ask if we can simply place another implant immediately. In most cases, the answer is no. The bone graft needs time to heal and become solid before another implant can be placed. Typically, this healing period is about 4 to 5 months, depending on your individual situation and how well the bone regenerates. If you have a loose implant, pain around an implant, a broken implant crown, or think your implant may have failed, don't panic. Many implant problems can be repaired, and even when replacement is necessary, there are predictable solutions available. The most important thing is to have the implant evaluated as soon as possible. The sooner we identify the problem, the more treatment options we may have available. If you'd like to learn more or schedule an evaluation, contact us at Dr. Mexico Dental Group in Tijuana. We'd be happy to help determine the cause of the problem and recommend the best solution to restore your smile.